Today, the expert who will be joining us is from Clove Dental. Basically, it is one of the largest, and I would say it's the India's largest dental chain with 350 clinics, 800 plus dentists, and 1 million happy patient. Yeah, I would say clients. This is a huge number. I'm getting Abdul. I'll join. I'll accept your request very soon. Don't worry about it. So I guess we have the expert with us from Clove Dental India. I have accepted the request. I guess yes. Hi.
Hi.
Hi, sir. How are you?
I'm all good. I'm all good, Mr. Harsh.
So the expert doctor from Clove India has joined us, and so basically I was just telling them that how important is the oral health, and we kind of ignore it. So I would love something from your side, just to introduce yourself, what exactly you do with Clove Dental, and it's been how many years that you're working with them? Just a quick thing before we start.
Yeah, I'm Dr. Indrajeeth. I'm working with, I'm a master's in the Department of Periodontics and Oral Implantology with an experience of almost 10 years. And I'm one of the senior members of the implant team in the Hyderabad zone. And I've been working with Clove for the past 6 months as of now.
Okay. And you're based out of which place?
I'm based out of Karnataka, but I'm currently working with Hyderabad Clove.
Hyderabad. Yeah, I was seeing the numbers of clinics that you guys have, 350 plus clinics and 1 million happy patients. This is a huge number, but I guess this should increase in terms of the patient count, because as of now we are a population of 140 crore people, and we are not much aware about the oral health that we should take care of. So I have few queries. I was also thinking of teeth implant for quite a time now. And I was thinking, take a expert opinion, and who better than Clove Dental, And I think
definitely
expert के साथ, और I was also, thinking that और भी काफी सारे लोग हैं जिनको इस बारे में जानना चाहिए. People should know about it and should actually go to their dentist at least 6 months or once in quarter. This is the basic thing that you should do. So the few questions that I have, basically, I have a list of questions that I've made. So
yes, please do.
Before,
I think dental sector as such is very much on a back step in our states. And as you perfectly said, once in a 6 months or once in a year, visit must be made a mandatory with all of us, so that जो भी problem है, initial stages में we can solve them rather than going for the higher expenses.
This is really important. पता है, we often try to ignore कि एक normal issue है, कुछ नहीं होगा, and then after 2-3 years we end up spending much more money and the pain that we go through. So it's really important to visit your dentist at least twice a year, I would say, minimum twice a year, and then if you can go quarterly, then nothing better than that.
It's a perfect
doctor, I would take first question that why should a patient get a missing tooth replaced? It's one thing very important, because we tend of ignoring it. कि यार चला गया दांत तो चला जाता है, इंडियन जैसी सोच होती है. So why it is important and why should people get it replaced?
सिंपल बातों में समझाने के लिए, see, let's say हमारा कार का एक टायर पंचर हो गया. So हमारे पास 4 टायर है. ऐसा नहीं है कि हम 3 टायर में काफी दूर चलेंगे. We generally tend to replace it. So in the same way, हमारे मुंह में जितने भी दांत हैं, each and every teeth has its own specific work. अगर बचपन में हमें समझाया गया था, सामने के दांतों से खींचो, पीछे के दांतों से चबाओ. In the same way, each and every teeth has very specific function. अगर एक दांत नहीं है, मतलब वो फंक्शन हमें कम हो रहा है. So it's always mandatory कि हमारे वहां पे दांत होना चाहिए वो पर्टिकुलर फंक्शन होने के लिए. The other thing, coming into the technicalities में क्या फर्क पड़ेगा हमें? In case, let's say, एक दांत 2 दांतों के बीच में एक दांत मिसिंग है, तो ये जो आजू बाजू के दांत है ये ऐसे सोने लगते हैं, और जो ऊपर का दांत है वो नीचे आने लगेगा ऐसे. सो एक दांत मिसिंग की वजह से वी आर स्पॉइलिंग सो मेनी अदर टीथ इन द ओरल कैविटी. तो अगर सारे दांत है तो सारे फंक्शंस अच्छे से हो रहा है.
ये आपने बहुत अच्छा एग्जांपल दिया कि जैसे गाड़ी में भी 4 टायर हैं, अगर एक
Yes,
आपका पंचर हो जाता है, you have to get it replaced. That's
yes,
like a mandate thing that you should do, but
yes,
not an
yes.
issue. Today, I hope we'll try to make a little change by telling people, you know, it's really important, the oral health, and especially the teeth implant. It's very important. So the
Yeah.
second question that I have, so dental Clove, what are the options that they offer for teeth implant? Like
See,
options or their offers, what exactly?
in case coming to, अगर पहले हम लोग बात कर रहे थे मिसिंग टीथ है, उसको रिप्लेस करने के लिए हमारे पास देयर आर लॉट ऑफ डिफरेंट ऑप्शंस कमिंग. पहला गोइंग फॉर द एक है निकाल के डालने वाला दांत है, जो हमें सुबह निकालना है और रात रात सुबह पहनना है और रात को निकालना है. द सेकेंड वन है ब्रिज बोलते हैं, जिसमें आजू बाजू का दांत को सपोर्ट से हम लोग बीच में बिठाते हैं. और द थर्ड आज का डिस्कशन हमारा जो टॉपिक है, दैट इज द इम्प्लांट्स. यहाँ पे
Yes.
this section of the teeth is where we specifically replace that particular tooth with as a clone to the natural tooth. ये हमारे नेचुरल दांत जैसा फंक्शन करता है या जैसा दिखता है या फिर जैसा काम करता है, इट इज एज गुड एज 95% एज गुड एज द नेचुरल टीथ. जितना अच्छे से ये फंक्शन करता है, इन द करंट एडवांसेस इतने आ चुके हैं, दिस इज 21st century we are working in, there are so many advances कि हमारा जो भी फंक्शन या लुक्स या ऑल दिस व्हाट वी हैव लॉस्ट कैन एग्जैक्टली बी रेप्लिकेटेड विद द हेल्प ऑफ एन डेंटल इम्प्लांट.
Okay.
या
So,
सो
इसमें for the same question I have this, what is the difference between a bridge and an implant?
yes, now coming to that, the bridge, it's the name itself is a self-explanatory bridge. हमारा
Yes.
जनरली जो भी नदी के किनारे में जो ब्रिज लगता है, उस तरफ एक पिलर रहेगा, इस तरफ एक पिलर रहेगा, दोनों के सपोर्ट पे हम लोग एक बिठा देंगे. सेम कॉन्सेप्ट एग्जैक्टली वर्क्स इन द डेंटल ऑल्सो. हम लोग क्या करेंगे, यहाँ पे एक दांत रहेगा, यहाँ पे एक दांत रहेगा, वो आजू बाजू को दोनों दांतों को घसेंगे. घस के जो हैंगिंग
Okay.
पार्ट है उसको हम लोग ब्रिज बोलते हैं. तब वी टेक द सपोर्ट ऑफ द एडजेसेंट टू टीथ और बीच का जो दांत है उसको हम लोग रिप्लेस कर देते हैं. This is a concept of a bridge, which was one of the traditional and the old age methods, which is still being followed. ये बहुत पहले से आया हुआ कल्चर है, the bridge concept, because बहुत टाइम पहले implants का इतना advancements नहीं था that we could do it in every cases. But आज का situation में ऐसा है, there are almost 98% of the cases where we generally can avoid going for the नेचुरल दांतों को जो घसने का ऑप्शन है हमारे पास, जिससे ब्रिज बनता है, उसको अवॉइड करने के लिए हमारे पास ऑप्शन है आज.
So, what are the special benefits of getting a dental implant?
Yes, this is where we are talking of the right questions. Yeah, see, main and the one and the foremost things of all of us want is, जैसा हमारा पहला काम कर रहा था हमारा नेचुरल दांत, exactly वैसे काम करना, which is perfectly solved by our dental implant. Second thing, coming to the looks. These days it's all about end of the day coming to the looks. So perfect aesthetic replications या फिर जैसा वो naturally लगता था उसका exactly उसी तरह replace करने का एक ही option is going with dental implants. Then the one and the foremost important thing is इसमें we don't touch any of your existing tooth. None of your natural teeth is disturbed at all. So the जो भी status तुम्हारा जैसा है उसी conditions यूज करेंगे. जहां पे सिर्फ दांत मिसिंग है, सिर्फ वो जगह को हम लोग यूज करेंगे और सिर्फ वही जगह पे आपके दांत आएगा ना. अगल बगल का कोई भी दांत को हम लोग टच भी नहीं करेंगे.
Okay. So, sorry for asking so many questions.
No, please.
Before going to it, I have make a list of questions that maybe some of the other people also have. So, सबसे important question जो आता है, especially for youngsters, we think अभी हम young हैं, we should not go for any dental treatment or teeth implant. So, अगर age के बारे में बात करूँ, you know, are there any age related or maybe any condition that we should go for dental implant or maybe teeth implant?
See, एक maximum age पूछ रहे हैं तो there is absolutely no limit at all, because the oldest patients I myself have treated is a 90 years old dadi. So youngest is, yes, we generally tend to avoid placement of implants until the age of 18 years of age, क्योंकि तभी भी हमारा bone ये वो सब all the things are still in the growing stage. So once the complete growing हो चुका है, so after that 18 years से you until the age of 100 or 120, whatever, जब तक आप दान चाहोगे तब तक we can go ahead with implant placement. There is absolutely no problem with it.
And the main and I guess the important thing that people don't have right now is time. So
Yes.
how much time a dental implant or teeth implant takes? That's an
Yeah.
important question, you know.
Yes. See, this is slightly where more than the time frame, I look at the longevity. हमारे कितना जल्दी होने से मतलब है या कितना लंबे समय तक हमारे मुंह में टिकने वाला इससे मतलब है. Because all
Yes.
the other options we have discussed अभी तक, see, you get other treatments done, cap डलवाओगे, bridge डलवाओगे. All this have a come with a time warranty. Let's say 8 साल, 10 साल, इसमें कहीं ना कहीं स्टेज में कुछ ना कुछ प्रॉब्लम आ सकता है. Implant is one thing where we actually give you a lifetime warranty. We say lifetime में कुछ भी implant का failure होगा, we'll solve it for you, free of cost.
This is amazing.
So,
Lifetime.
yes.
So that's
Implant once, that's where I'm coming in. Healing time देना जरूरी है यहाँ पे. So
okay.
as you said, there are options. One thing is we place an implant and we can immediately give you the teeth also. This is
Okay.
very condition specific again. And there is one more stage where we place the implant, we wait for 3 months उसको heal होने
Okay.
के लिए. And we give
Okay.
the tooth. So
Okay.
उसमें क्या होगा? Once the healing period हम लोग अगर छोड़ेंगे, so the longevity keeps on increasing because एक बार this is like पेड़ और जड़ जैसा
Of
होता है
course.
ना.
Of course. Of course.
It's,
Yeah.
पेड़ को आप जितनी देर छोड़ोगे जितना मजबूत हो जाएगा उसके ऊपर कितना भी बड़ा पेड़ होने दो, नीचे कितना रूट कितना स्ट्रांग है उससे मैटर होता है. Exactly the same
Okay.
concept works with the dental implant also.
Oh, that's great. I guess I'm done with my questions, and these are really important one and very, you know, important for people who are watching. And maybe I'll also pause this because this is really very important conversation we are having. I'll pause this on my feed so as many as people can see it after this live, or they want to send it to their friends, because dental, you know, oral health, dental care is very important. I guess we have few questions. So before taking the question, I would love in the end just share 3 or 4 tips, a basic tips to the audience that they should follow, you know, for dental care. So we have few questions. Let me take few. Okay, we have. Lots of people are joining and going, so questions are बीच में चले गए हैं. Hi Naveen, how are you? What about for RCT? What that means, doctor? I don't know about it. RCT.
Is that the full question? वो पूरा
Yeah. What
question
about for RCT?
In case of an RCT is a short form abbreviation for the root canal treatment. Root canal treatment is done in case of जहाँ पे आपके दांत कीड़े लग गए, तो in case it has reached the pulp, we go with root canal treatment. In case where implants come in case let's say your teeth has got broken even after the root canal treatment, in such cases we remove the root canal treated teeth, we place the implant in that region. जिस दिन हम लोग there are options wherein जिस दिन हम दांत निकालेंगे, same day we can place the implant also in the teeth in the same region.
Okay.
And leave it for some time. Today एक 2 महीना उसको complete heal होने के लिए छोड़ देंगे, and later on we can place उसके ऊपर दांत लगा सकते हैं. So you don't have to like दांत निकालो, थोड़े दिन wait करो, and later on you go ahead with the dental implants. ऐसा कुछ नहीं. Immediately you can go ahead.
Cool. One, I guess we have a feedback also. This is not a question. We have a feedback from Sandhya Prasad. She got a treatment in Bangalore. I guess she have some query. So maybe you just inform the Clove Dental team to reach out to her once. I guess she has some queries. She has some feedback to share. So we'll take it, Sandhya, for sure. Don't worry about it. How to remove dental plaques?
Yeah. Dental plaques, you have to, as initially, as Harsh said, every 6 months or 1 year, you keep visiting one of the dental facilities. Get your basic. The basic thing is basic cleaning. You definitely get a cleaning done, and after that, वो क्लीनिंग में ही और रूटीन चेकअप हो जाएगा, वेर अगर आपका इनिशियल दांत सड़ रहे हैं या एनीथिंग, वी कैन आइडेंटिफाई दैट इनिशियल स्टेज इटसेल्फ.
That's great.
So
So
yeah,
I guess these are the enough questions, and I've already asked so many questions from you.
yeah,
I hope this will help a lot to people. So
yes.
last 3 to 4 tips, everyday tips that you wanted to share to the audience, so that will help them to, at least take care of their teeth, and they should visit Dental Club at least twice a year. So one, three,
Yeah.
four tips that you wanted to give to them, or maybe you also follow everyday routine.
Yeah. See, first thing is, see, in regard with respect to, let's, to wrap up with the dental implants per se, our हमारे major consideration of the satisfaction where we find is we on treating हमारे old age people को, who are completely lost their teeth, और उनके साथ हम लोग बाहर जाएंगे and they'll be like, नहीं तुम लोग छोले भटूरे खा लो, हम लोग लस्सी पी लेंगे, ऐसे वाला सिचुएशन आने वाले सीन. बट दिस इज वेयर द डेंटल इम्प्लांट्स, दिस कैन रिप्लेस योर ओल्ड एज और दादा दादी या ये एज ग्रुप में जो हम लोग रिप्लेस कर सकते हैं उनको. वी गिव देम अ कंप्लीट सेट ऑफ टीथ वेयर दे कैन एक्चुअली ईट your chole bhature, your parathe ke gali ke, all the parathes, all such things. This is where actually the dental implants, where I actually feel satisfied in providing a rehabilitation. So these are the primary people where I consider really important, whom we should get them, because we are the educated sector, and they are, सिर्फ हमें ही आइडिया है कि ये सब ट्रीटमेंट. To go ahead. And coming to the tips section, see, primarily, as all dentists say, the दो बार तो brush करना ही है. That is without a fail. Sure. That is the first 9 out of the 10 dentists. I am also in that 9 out of the 10 dentists who is telling you brush twice always. Yeah. And more than brushing, जितना time आप spend कर रहे हैं उससे मतलब नहीं है. Stand in front of the mirror and see that your brush is touching each and every single tooth.
Yes, mirror के सामने खड़ा रहकर
मिरर के सामने 3 मिनट स्पेंड करो, इधर घूमते घूमते. that's not how you brush with this thing. Use your dental available facilities at least once in a year. At least once in a year compulsory एक dental. Me being a dentist, I'm a specialist in specifically in the department where I know exactly 10 साल वही पढ़ाई किया कि कैसा ब्रश करूं, but still I get a cleaning done once in a year.
That's really important.
Yeah. So imagine the general status. So this is one important thing. Second one is always use a floss, और जो भी initial statement में initial stage में तुम्हारा problem है, get it checked. Don't let it aggravate it off. सेंसिटिविटी या ब्लैक डॉट दिख रहा है आपके मुंह में, कम हैव अ चेक. जो भी इनिशियल स्टेज में होगा इट इज वेरी इजीली सॉल्वेबल. यू कम आफ्टर 10 years, we'll do all the 10 years का ट्रीटमेंट combined at once at that point of time.
That's nice. Yeah. Okay, what else? Maybe last one more tip. I'll also add one more tip that I follow.
Okay,
this might help. Yeah.
The last one is mouthwash. Mouthwash using should be very specifically done. I don't recommend it in each and every case. So this is where your dentist comes in hand कि किस stage, किस situation में mouthwash use करना चाहिए, किस situation में use नहीं करना चाहिए. This is one more. And I have a last one also. Yeah.
Okay.
Don't open bottles with your teeth.
This is really important. I've seen so many people, especially in Delhi, NCR, people do it. I can't even do it. So this is really important.
Definitely don't come, because the moment you open such bottles with your teeth, the next person you're going to see is one of us, one of the implantologists.
For sure. Yeah, I guess I'm after talking to you, I'm much more confident and not scared. I'll definitely go to Clove Dental near me. There's so many Clove Dental near me that I have to. It's near very 2-3 kilometers, I guess. It's so. Gurgaon, Delhi, NCR, there's so many 350 plus clinics all over India. So I'll definitely go and go for teeth implant. I have one teeth here, which is that you mentioned. It's one of the between teeth. which is got infected and taken out, and
Yes.
it is actually creating issues. I'm not able to
Yes.
chew from this end, so I'll definitely try. Will go to Clove Dental and share my
Yes.
experience with everybody. A different video altogether. One more tip that I wanted to add in the doctor tip is that change your brush
Oh,
frequently. Not
yes.
don't use maybe brush for ages. I have seen people using the same brush for 2 years. I prefer to change my brush after every quarter. So maybe, but twice or twice a year you should change your brush, because उसके अलावा वो brush
It's
काम का होता नहीं है.
Yeah, it's actually you should be able to change the brush once in 3 months actually,
Once
specifically.
in 3 months.
Yes, once in three
So
months.
that I do quarterly.
Yeah,
So that's, I guess I'm doing fine. I have
yeah.
to make it a routine of brushing my teeth twice a day. That I often don't do it, but
Yeah.
I have to do it. So
Yeah.
I hope this Clove Dental India chat session with the expert guys here will help you guys. So lastly, to summarize the call, teeth implant is very important. If you are thinking, if you're scared, and if you're hesitant, if you're ignoring it, don't ignore it, because this can actually, ruin your other teeth nearby. Brush your teeth twice a day, go to dental twice a year. These are the basic things that you have to maintain. The oral, day in a year, that is also coming, doctor, right? This is on 20th.
Sorry?
The oral health day.
Yes, yes. Oral health day is coming up.
It's 20th,
We are
right?
going to
20th
create.
March.
Yes, it's the 20th of March. We're going to create an
So make
awareness
sure
day.
to make sure the oral dental day is coming. So book your visit to your dentist nearby Clove Dental. There's so many clinics. So oral day आप बनाना चाहिए to maintain your health of your oral, which is important. And उसके अलावा भी कोई questions है तो you can reach out to Clove Dental. You can reach out to me. I'll pass on some questions to the expert guys. And anything else? Last 1 minute. If anybody has some questions, we are getting so many thumbs up. डॉक्टर ने बहुत ही इंपॉर्टेंट हमारे साथ टिप्स शेयर करे हैं. सो आई गेस दिस विल हेल्प. सो आई विल मोस्टली वी हैव कवर्ड एवरीथिंग. एनीथिंग फ्रॉम योर एंड डॉक्टर? एनी लास्ट कमेंट्स?
I think we have summarized the whole, and the whole session has been educating. It's more of how much input we take out of this session, more than what conversations we have. It's more about having this session and taking the inputs what we have provided. I think we both have made it absolutely clear the importance of the dental implants, the replacement of the missing teeth, and more than that, it's always being in a very well educated and a well planned dentist in your vicinity. That is where I guess Clove India comes in.
Of course. Thank you. Thanks a lot, doctor. So thank you everybody who's ever joined. We'll be posting this video on my feed. Check it out. Share it with your friends. Book your visit to your dentist. Oral health day is also coming. So see you soon and visit your dentist. Bye bye. Thank you. Thank you, doctor.
Yeah.
Bye
Thank
bye.
you so
Take
much.
care. Have a great weekend ahead.
It was a lovely conversation.
Thank you. Same here.
Thank you.
Thank you, doctor. Bye bye.
Thank you.